Okay. So, how can somebody get an early diagnosis of fatty liver? What are the few symptoms? And also, what are certain lifestyle changes they can make once the diagnosis has been done?
See, as far as symptoms come, if you're symptomatic, then the liver disease is too far ahead,
Yeah.
right? If you're getting jaundice, if you have a decreased appetite, if you're swelling in your legs, abdomen, that means the liver disease is gone way past, probably reversal. But what we are looking at is to catch people early, and that's where these health screens make a role. Your annual health check that usually comes up with ultrasound saying you have either grade 1, 2, 3 or 4 fatty liver, and you have a liver function test which is also done, which can be deranged, which gives us a pointer to say, okay, something is wrong. But supposing people are not getting annual health checks, I think people who if they are diabetic, they're hypertensive, they're obese, especially in Indian population, if they have something called a central obesity, that is in a male, if you have a waist circumference more than 90, and in a female, if you have a waist circumference more than 80, then we know that they are prone for fatty liver disease. Why we worried about fatty liver disease? One is, of course, it becomes chronic and it can lead to chronic liver disease. We're also seeing increased incidence of cancers in the liver because of fatty liver disease, primarily, before even going to chronicity. And also these fatty liver disease is an harbinger for problems elsewhere, like in the kidney or the heart. So catching fatty liver disease early can be of great help sometimes. And why we need to catch it early? Because like I said, it's a lifestyle disease. If you're able to manage your lifestyle, if you're able to reduce your weight, if you're able to start living healthy, chances are that you can reverse fatty liver disease and, potentially lead a liver disease-free life.
What would your recommendations be to get an ultrasound yearly if you have hypertension or diabetes or you're obese, or only go for ultrasound if your liver function is deranged? How often should they get screened? Or if there's a family history, they should be more prudent about it. How would you?
Well, earlier I was not really keen on these annual health screens, but off late I feel, say, somebody's about 30, 35. Annual health screen definitely helps. And like if you have these high risk factors, like if there is a thyroid issue, if you're diabetic, hypertensive, obese, then probably a yearly ultrasound will help with along a liver function test. I think basic blood tests also need to be considered. For example, your lipid profile, cholesterols, right, your sugar levels. I think they should be more frequent checks, maybe an annual health check. Of course, for different people, we have different screening intervals. It depends on the risk the patient has. Liver function test primarily not really indicated. Maybe, as a part of a health package that can be done. And we also need to screen for viruses, because sometimes we do get this hepatitis B, C, which are now, especially hepatitis C, we can virtually eliminate the virus. So it's very important to check for these viruses. Or if it is hepatitis B, we can always start a medication. A simple medication will keep things under check. So these are small things that needs to be done, I think.
Okay.